All right, but it's 101, so I think we can start the event today. I just wanna thank everybody who is here today for coming to our very first forum on language assistance services. As mentioned, this is an initiative that DMAS has put together for a long time. And today is the celebration of the first forum. I wanted to thank everyone at DMAS, in particular the leadership team, for allowing us and supporting this initiative, which we consider it's going to be very important for our community, for those who are limited English proficient and those that have disabilities. Let me just make sure, let's see. I just wanted to make sure who we have. Okay, so before we move on, I just wanted to allow our Director Roberts present and share a few lines for us. Cheryl, Director Roberts, are you here? Let's see. I got confirmation. Well, let me see if I can. All right, I think I needed to change you as a presenter. Here we go. Thank you, Director Roberts, for being here today. I believe you mentioned you would like to share a few words with the audience.
Yes, isn't this exciting? First of all, happy spring. For the mothers who are here, happy Mother's Day. I want to hear something happy. This is a happy meeting. This is not a sad meeting. Who's here because they have to be? You can put your hands up. You say, I must be here. Nobody's putting hands up. Who's here because they want to be? Okay, see, good. Thank you. All right, because this is a gift. This is not necessarily we're doing this because we hate it. We're doing it because we love it. Okay, and this is one of our accomplishments is that we have spent the energy and the time and the investment so that we can actually spend energy to talk and communicate better with our members. So this is a beginning. All right. So anyway, good afternoon. We're excited. This is our first forum on language and disability access. And Bernice, I'll try to slow down so that I won't go so fast. Okay, right. We've been working towards this since we hired our first civil rights coordinator in 2019. So this has been a couple of years in coming. But I want to highlight a few things that we did. In 2020, we actually completed an assessment and access need assessment because we were trying to figure out when you have like 2 million people that you're trying to speak to and communicate to, you want to make sure that you're doing it in the best way possible. And one of the things we recognize is that the way we were doing it was not necessarily the best way, not necessarily the bad way, but not necessarily the best way. So the way you start off with it is to figure out where are you, so you can figure out where you're going. And then we developed and implemented and released the access plan. It's our language and disability access plan. And if you're interested, it's on our website. Have any of you looked on our website to look at it? Can you put a hands up if someone has done it today? Humor me and say, yes, I have done this. Thank you. Yes, thank you, Kathy. You're going to win lots of awards. All right. Then the other thing is for our Medicaid notices, then we translated it. And, you know, in the past, we only did English and Spanish, but now we have English and Spanish, and we have basically 5 most used non-English languages that are translated. And then we also supplement our language taglines we have written in 17 non-English languages with individuals with limited English proficiency so that we're able to help. And we also included a non-discrimination notice supplement. Our civil rights unit, which of course you just met her, one of our top people, developed and implemented a Spanish language skill assessment. So all the DMAS bilingual staff that will help in interpreting and translating functions. In other words, what we're trying to say is in your organizations, you always find people who have talent and skills. And what you're trying to do is maximize those talents and skills. It doesn't mean that they have to be isolated. So if someone has that, can speak bilingual, it's good to incorporate them as you're starting to have your discussions on language and access, especially because there are nuances that you can actually get that you can't get when you're actually trying to do this on the system. Okay, and then we hired a digital accessibility officer to ensure all DMAS digital communications are 508 compliant as per ADA. And then we also drafted access standards, enforce our interagency agreements and MOUs. Because again, the goal is not just to be isolated, but to be actually increased. Right? We're trying to spread the wealth, not try to isolate it. And then we developed and implemented language and disability access related trainings, as well as linguistic and cultural competency trainings. So, long list, but here's the good. The good is we want to continue to build on this work. Extremely proud of this team, extremely proud. And also we are certain that this forum we'll do a couple of times a year, but we need your input. You can see what I'm going. Make sure you're in the chat and you're active, and that you can say what we're doing well or what we're doing poorly, or if you have any questions or ideas that you want to do it, because this forum can only be as good as you are interactive with it. All right, so thank you.
Thank you very much, Director Roberts. You always bring so much knowledge and energy. It's very appreciative. We can move on to our agenda. Before we go through the agenda, just a couple logistics I wanted to share with everyone, and that is that we have 2 American Sign Language interpreters. So those that might need the service, they are on camera. We also have remote captions, and those are embedded. So those that want to follow the event with the remote captioning or card services, all you have to do is click on the 3 buttons down your screen and activate the closed captioning. Those are being provided by Virginia Relay today. I also wanted to let everyone know that the meeting is being recorded, and that after the event, we will upload all the materials that we have shared today, and you will be able to access them, including this presentation, at a later time. It will be uploaded onto our DMAS website. Also, we have the chat, so if you would like to ask any questions that are related to language and disability access, please feel free to put those questions in there, and we will, as time allows, we will address them at the end of the event, or we will address them at a later time and upload them for your review at a later time. And that's all I have as far as logistics. The agenda, yes.
I'm sorry for the abrupt interruption. We have a report that apparently the embedded captions are not looking well. So we are going to share in the chat the link to have access to the closed captions in a separate window too, okay?
Thank you, Jesus. That's why I thought it was such a great help to have Jesus and also Dana help us today. But let's go through the agenda, and we've gone through the introductions. We will also later hear from Sarah Hatton, our Deputy of Administration. She's going to provide us an opening keynote. We will have a section on Virginia Medicaid news and updates. Then we will have a short presentation on language assistance services, the examples, requirements, and importance of the service. And the big bulk of this event today, it's going to be our panel discussion. We have invited these agencies to speak today about language and disability access and provide us best tips that they currently do at their organizations. We're going to have the Disability Law Center, Enroll Virginia and Central Virginia Legal Aid Society, VCU Health, and Virginia Department for the Blind and Vision Impaired. We will have a very good discussion. And just to close the event, we will have a Q&A session. So if you have any questions, again, keep putting them on the chat. We will address them at the end of our presentation, and we will have our closing remarks, and the event will end at 3 p.m. And without further ado, I'd like to have our Deputy of Administration, Sarah Hatton, give us a few words to introduce the event.
Thanks, Montserrat. I appreciate it. Can you hear me okay?
Yes.
Great. So I do want to say, first of all, it was really great hearing all of the accomplishments that Cheryl, Director Roberts, was listing earlier. I am incredibly proud of this team and all the work that DMAS has done through their leadership over the past few years. One of the other divisions that reports to me as Deputy of Administration is the Division of Eligibility and Enrollment Services. And they've also done a lot of great work over the past few years to really bring DMAS forward. One of the things that Cheryl mentioned was our eligibility notices. That was a passion project for me and for a lot of people here at the agency. We really wanted to be able to have automation for our translation services. And so we were able to make systems changes over the past few years that automatically translates all of our eligibility notices into the top 5 languages. And with these languages included, that is 99%, over 99% actually, of our Medicaid enrollees. So they will all receive their notices and their important information about Medicaid in their own language. And then for the remaining population, the less than 1% that speak another language that we don't have that automatic translation for, they can actually contact us by using the information that we include in the taglines, and they can receive an interpretation or translation service through that route. You may have all heard that Virginia, like all states in the country, we are starting off with Medicaid unwinding. And this basically means that we, after 3 years of the public health emergency, we are now redetermining every individual who is in the Medicaid program over the next year. This is a huge undertaking, but it was also really important for us to make sure that we had information leading up to the unwinding beginning and during the unwinding, so that those with limited English proficiency and individuals with disability would be able to access all of the material and to have all of the tools that they need to make sure they didn't lose coverage and that they received their important paperwork and information. And we can't stress enough, we know that during this period, it's really important that everyone receives their information timely. And we know that it's very critical for these populations to receive the information in a manner that they can actually understand and that is accessible to them. And so with that, I will say, we're really excited about today's meeting. This is the first forum that we'll be holding. We do see this as a building block for future meetings. We know we can't do this alone, so we really value all of our partners who came here to participate with us today. And we also want to hear from anyone in the public who wants to participate. And I know Montserrat will walk us through how we're going to get everyone involved as the meeting progresses. But thank you all again for coming, and looking forward to a great meeting with you.
Thank you, Sarah. We appreciate your time and your words. So we're gonna move on to our next section, and that is about Virginia Medicaid news and updates. We have Jesus Perez, or DMAS Civil Rights Compliance Specialist, who is gonna be sharing some of the important highlights about Virginia Medicaid.
Hi again, Montserrat. Hello, everyone. Well, a lot of things have been happening here at DMAS lately. So we want to share some updates. We want to share some news that are about the things that have been happening here at DMAS. And the first information that we want to share with all of you is that Cover VA's website got a new look. If you haven't already noticed, the Cover VA website has a fresh new look. You will find the same information as usual, but it has a new location. So be sure that you have the new web address. This is coverva.dmas.virginia.gov. I will repeat that for you. coverva.dmas.virginia.gov. The old address will redirect users to the new address indefinitely, and you will notice that the new site has a very similar look and feel than the DMAS website. So If you have any questions about this change, you can contact us at covervirginia@dmas.virginia.gov. Another update that we want to share with the public is about the end of the continuous coverage. As was already mentioned, last March, Virginia resumed conducting Medicaid and FAMIS renewals for the first time since March 2020. This means that we need to have redetermined the eligibility of our 2.2 million Virginians enrolled in Medicaid and FAMIS. This is why it's very important to be sure that we have the current information of all our members. We need to have the mailing address, emails, and phone numbers updated. So be sure that you, or if you know someone who is a member, be sure that you have all this information updated in our systems. Something else that we want to share with you is that we are now Cardinal Care. What this means that Virginia Medicaid has a new image, and what this represents is that our two managed care programs, the Medallion 4.0 and the program Commonwealth Coordinated Care Plus, as well known as CCC Plus, are now combined into one program, and the name of this program is Cardinal Care Managed Care. Remember, we now are Cardinal Care Managed Care. Something else that we want to share with you is that Medicaid and FAMIS notices are now available in more languages. The Department of Medical Assistance Services and the Virginia Department of Social Services have been working hard translating key Medicaid and FAMIS correspondence into 5 additional languages. And last but not least, as of April 1st, 2023, there were 2.19 million Virginians enrolled in Medicaid FAMIS. So these are some of the most relevant news that we have here at DMAS and that we wanted to share with the public. Montserrat.
Thank you so much, Jesus. Great news, a lot of work being done here, and I appreciate you all being here and being patient too, because I just realized that the slides were not running as they were supposed to be running. So I think we got that fixed, and we have the slide presentation flowing as it's supposed to flow. And I apologize for any inconvenience. So let's move on to our next section for today's event. And it is a presentation that we thought it would be very helpful for everyone here in regards to language assistance services. Sometimes we assume information, but just it's going to be like a 4 or 5 minute presentation just to provide information about what language assistance services are, provide some examples, also mention what the requirements are and the importance. So let's move on. And this is a presentation that I will be providing today. And let's start with limited English proficiency. What type of language assistance services are provided for limited English proficiency individuals and also those that use American Sign Language? And I usually like to classify them in 2 groups, 2 categories: verbal services or related to interpretation, and also written services, which most are related to translation. So under verbal services, we provide, or we can provide to assist in communications, telephonic interpretation. That's one of the ones that is used the most among agencies. We also provide, or we can provide to limited English proficient individuals, in-person interpretation. And nowadays, technology, because has continued advancing, we are extending these services to video remote interpretation, which can be very convenient and very helpful to communicate with limited English proficient. In the written realm, we relate those services to what we call written translations. That means that written translations are usually services provided either in paper, but we cannot forget that nowadays with the new advancement of technology, those written translations are also provided for digital content. So that means web pages or any applications. A lot of organizations are starting to having virtual portals, electronic communications like email. Those are important to keep into consideration and to also find ways to provide language services to this community. For meaningful access provisions, I thought it would be helpful to provide what are the regulations that we follow in order to provide language access and auxiliary aids, and that is that Title VI of the Civil Rights Act of 1964 requires recipients of federal funding to provide limited English proficient individuals with meaningful access to their programs and services. And also there is another regulation that came up later, and that is Section 1557 of the Affordable Care Act, that established a little bit more specific requirements in regards to language access and the use of interpreters. It is important to know that there are different factors that take into consideration when choosing the most appropriate language access service for individuals who are limited English proficient. And those factors are usually summarized in 4. One of them, or number 1 factor, is the number or proportion of LEP persons encountered. It's an important factor to have in mind when deciding what type of language assistance services an organization can provide. Also, number 2, a second factor will be the frequency of contact. That's also another important factor to consider when providing language services, and what type of language services and what type of languages. So understanding how frequent your organization communicates with limited English proficient individuals and what language are the most frequently used, it's a very important factor to assess for your organization. A third factor will be the nature or the importance of the program. The more important the program it is for individuals with limited English proficient, the more likelihood that you would have to provide language access services. And lastly, it's important to consider as one of the 4 factors the resources that the organization has available. All right. So in this presentation, I also wanted to highlight another type of language access services available to individuals with disabilities, and that those are named as auxiliary aid services. The Americans with Disability Act defines them as ways to communicate with people with communication disabilities, and the auxiliary aid services that can be offered to individuals who are blind or with vision loss or deafblind are, for example, qualified readers, information in large print. It's also a service that it's provided quite often for this population. Materials in Braille, materials electronically offered that are used through a computer screen reader. Those are also additional services that can be provided to group of individuals. Audio recording, it's also another option, and printed information is also another resource. For individuals who are deaf with hearing loss or deafblind, there are services that are used commonly to communicate with them, such as, for example, qualified note takers, qualified sign language, for example, acute speech interpretation, or tactile interpretation, or real-time captioning, for example, like what we are providing with the event today, and also written materials or printed script or yeah, basically like a printed script of something that is being provided. And lastly, for those individuals that have speech disabilities, there are certain services like qualified speech-to-speech. It's called with the word transliterator, which is a person that is trained to recognize the unclear speech and repeat it clearly. This is another type of communication that can be offered to individuals with speech disabilities. And I also wanted to provide a high-level overview of some technologies that are also available to individuals with disabilities. For example, real-time captioning or card services that we have already described before and that are being provided here during this event. Other technologies also available are telecommunications relay service, or also known as TRS. And those are reached by calling the number 711, and they use communications assistants who serves as the intermediaries. And another technology is video relay services and also video remote interpreting services. So those are some of the technologies that are currently being used today. A lot of new technologies. It's important to stay up to date of what is being offered as we continue serving communities who are or who have communication disabilities. So being aware of the different auxiliary aids and technology services available to individuals with disabilities is very important so that we can communicate effectively with them. But also, it is important because we must be in compliance with the Americans with Disability Act and Section 508. And the Americans with Disability Act, Title II, requires entities to provide aids and services when needed to communicate effectively with people who have communication disabilities. And Section 508 of the Rehabilitation Act requires electronic and information technology to be accessible to people with disabilities. This is something new that a lot of organizations are trying to stay up to date, and because we continue having more communications done electronically through our websites or emails, it is important to make sure that they are Section 508 compliant. And similarly to the four-factor analysis that we were evaluating before, there are also important factors here to consider when providing auxiliary aids or technologies to individuals with disabilities. And those factors are here depending on the nature of the encounter. You will provide, or the agency can provide a different type of communication. Also, depending the length of the encounter, it's also important when choosing what type of language access service to provide. The complexity of the conversation, that's also another important factor to consider. The context of the conversation or the encounter, and also one of the most important ones is the person's normal method of communication. So before trying to find a language access service or an specific auxiliary aid, is always very important to ask the person who has the disability what is their normal method and what would meet their communication needs. So as the last slide for the presentation, I just wanted to highlight the importance of offering these language access services and auxiliary aids to limited English proficient individuals and people with disabilities. You might most likely have guessed a lot of these important factors, but mainly it just provides a better experience to all. When we try to communicate with individuals, the more effective we can conduct that communication, the better experience that we can provide to somebody. It also ensures effective communication. For example, in the medical setting, it is very important to provide this communication so that we can improve the patient health outcomes and that we reduce medical errors and that we, on the long term, reduce any long-term costs. And lastly, it is very important to provide these language and disability access services so that we can eliminate any access barriers and make sure that our community can access our programs and services. So this is all I had today for our presentation. And I wanted to move on to our panel discussion, and I'm just hoping that providing this panel discussion, this format, we are all gonna learn from each other. Again, as Director Roberts was saying, we encourage everyone to put in the chat or submit to us any additional thoughts or questions, but mainly what we want to highlight in this conversation with all these organizations is how they are providing these services, some tips on how they're doing it so that we can learn from each other. Today, we have Lydia English with the Disability Law Center. We also have Evan Lee Ferran from VCU Health. And from Enroll Virginia and Central Virginia Legal Aid Society, we have Carla Torres and we have Sylvia Jones. And with the Virginia Department for the Blind and Vision Impaired, we have Susan Davis. First of all, thank you very much, everyone, for being here today, sharing your time or your amazing resources while serving the LEP community and people with disabilities. If you would like to be on camera, so that, and also have your microphones on. The way we're gonna run this session is we have put together a few questions and I will be moderating the questions and I will ask each organization to provide us with their tips or basically what they're doing in regards to that question with their organization. So I'm going to start letting them introduce themselves. And again, this is going to be so we have enough time. Let's make sure that we all as panelists can keep our interactions for 3 minutes every time that we ask a question. But yeah, let's start with the Disability Law Center and Lydia English. Good afternoon, Lydia.
Hello, everyone.
Yeah,
Thank
if you
you
would like
for having us, Montserrat. That
Of
is
course.
a wonderful invitation. Can you hear me?
Yes.
Yes, sir. I am an advocate at the Disability Law Center of Virginia, and I think the reason I do this kind of work is because during the whole time being here in Richmond, my main kind of job has been assisting the community in different areas. And because it was the need of assistance, the Hispanic population was created with all the newcomers. So it's a passion to do it. It is a right to have services, and I believe that we can make a difference. So thank you for having us today.
Thank you, Lydia, for the introduction. Carla and Sylvia, if you'd like to introduce yourself and give us a little background on what you do.
Sure. Thank you so much, Montserrat. I'm Carla Torres. I'm a healthcare navigator coordinator with Enroll Virginia. Enroll Virginia is a community-based network of organizations which mission it is to provide affordable healthcare access to Virginians. And what we do in the community, we do outreach, we focus on enrollment with the marketplace and Medicaid, and we also do education. I work at Central Virginia Legal Aid Society with Sylvia, and I'm gonna let her explain what we do in Legal Aid. Thank you for having me. I'm very happy to be here.
Thanks, Carla.
Good afternoon. Again, I'm Sylvia Jones. I was a last minute add-on to this panel, so I'm really happy and pleased to be here. And as Carla mentioned, I work with her at Central Virginia Legal Aid Society. I am the Director of Advocacy. So my role is basically over all of the advocates. Central Virginia Legal Aid Society, as the name implies, provides legal services to underserved communities, and we have offices in Richmond, our main office, and we also have offices in Charlottesville and Petersburg. So I'm not new to the notion of language access, but my goal is to make sure that we are doing everything we can to provide the best language access we can as an organization.
Thank you, Sylvia. Thanks. Glad to be glad that you are here today. Let's go through Evan Lee with VCU Health.
Good afternoon, everyone, and thank you so much for organizing this event. This is really great, and thank you to our ASL interpreters as well. My name is Evan Lee Paran. I'm the manager of language services at VCU Health. Our health system receives 7,000 to 9,000 LEP patients every single month in our health system, mostly ranging in Spanish, but also 70 other languages from across the globe. And we have a big job, right? So 24/7 language access through all services, not just our clinics, but also our emergency services, ICU and inpatients. And so we offer services from document translations, video, phone interpreting, and on-site interpreters as well.
Thank you. Thanks for being here today. And last person in our panel list is Susan. Please, if you'd like to introduce yourself.
Yes, good afternoon. My name is Susan Davis, and I am with the Department for the Blind and Vision Impaired. And I feel compelled actually to share with you a very quick quote from my colleague, Eric Raff. He's not anticipating this, but he and I talked a little bit recently, and one of the things he was saying, actually, he wrote me a note, and in the note, he said, it's really important to note that spoken language and American Sign Language interpreter services have the same goal, the same intent, access to services through our constituent languages. But that's where the similarity ends. The industry practices, interpreters, and even the federal laws are so vastly different, and a lot of people fail to understand this. It's cool to be involved today with discussion. We'll be talking about people with disabilities and language access, as well as limited English proficiency. And so, good afternoon, and thank you, Eric, for your wise words.
Thank you, Susan. I appreciate you being here today as well. So let's move on to our first question. We have around 5 questions that we would like to ask the panelists today. And of course, each agency has different language and disability access needs according to their programs and services and according to their own population. So we will just go around the table and just discuss what each agency is doing according to their own language and disability access needs. One of the questions we wanted to discuss is what does your agency do to communicate with individuals with limited English proficiency, individuals that are deaf, hard of hearing, blind, or with low vision. So let's start with Enroll Virginia. If you would like to let us know what your agency does.
Sure. So in CVLAS, we make a concerted effort to hire multilingual staff. And we have a policy that encourages bilingual staff who reflect the languages spoken in the service area. We have a committee that is the DAVE committee. And for the ones who don't know, it's a diversity, equality, inclusion, and belonging committee. And this committee is it's formed to ensure diversity in all areas of the organization. Currently, we have 12 members in CVLAS who are bilingual. In terms of hiring staff interpreters, we don't hire staff interpreters per se. However, we hire bilingual staff. And as far as in Enroll Virginia, we have a total of 31 navigators statewide. We have 13 navigators who speak Spanish and 2 Korean and 2 Vietnamese. And for instance, this is just one example. On Thursdays, we have Healthy Thursdays, and we do these lessons. They're just typical topics about healthcare, marketplace, anything of interest. It could be marketplace with taxes, preventive medicine, and what have you. So we have these panels through Facebook if anyone wants to watch those. And then we have these panels with bilingual interpreters, and then they can do the panel in English and then in Spanish. As far as contracting interpreters, we have a policy and budget on place and CVLAS to appropriate funds each year. So there's no charge for the clients for interpreters. And when the attorneys at CVLAS, they go to court or hearings, we can arrange with the court in advance to have an interpreter. And in these cases, the court pays for the interpreters. In terms of using the interpreter line, this is a service that we have, and we use it as a supplemental service, especially when we need to talk with the LEP individual quickly or when services are needed in an infrequent language. I don't know if Sylvia, you want to add anything as far as CVLAS?
No, I think you pretty much nailed it, Carla. Thank you. You know, as you're aware, you know, we want to make sure that we're meeting clients where they are when they come in the door, and we do try to have signs that are visible. We have a lot of signs in our office, so it's probably understandable if they don't see it. But we do have signs that guarantee to folks who do not speak English or limited English proficiency that we can speak to them in any language that we need to, or in any modality that we need to as well. That's it. I mean, I'll share a very short story. I'm going to just spill my guts right now. I won't have much more to add to this, but one of the more unique experiences that I had, and just by way of a little bit background, we also have a partnership with VCU. It's a medical legal partnership, and we get a vast array of clients through that, probably larger than a lot of our service areas. But when I was in another legal aid program, we had a situation where we had 2 deaf parents, and we had a child who had some very severe disabilities, and had a sister who, we got this client through the medical legal partnership and had some vast medical needs. And so the sister was trying to help her, the younger sister, and the parents were not able to help. So she spoke English. The parents were deaf. They were also from Nepal. So what we needed out of that experience was a power of attorney, because VCU would not talk with the older sister without a HIPAA form. And so in order to get that and to get the medical power of attorney in place, I had to scratch my head a bit on like how to have deaf sign language in Nepal. And so actually was able to find someone through Catholic Charities, and I was able to draft the POA and get the parents to, and it was a fairly intense and long process, but to go through the power of attorney and sign language and get their consent. So, we try to be creative, and our main goal is basically to serve the client in any way we can. We are a federally funded agency with funds that can go up and down each year, and so we really do try to make the best and be creative. The language line that we use covers the vast majority of the situations where we need to have communications with our clients in different languages.
Thank you.
And I'm sorry if I went over the 3 minutes.
No, this is great. Just sharing our experiences is the most important thing. Again, we're not trying to provide any legal advice with this conversation. This is just informational purposes only. As I stated before, each agency have their own individualized needs. So we just wanted to emphasize and welcome all these tips and all these stories to help us all be better providing language access services. If any of the agencies here attending the event, listening to the event, they have any particular questions regards legal requirements, that's something that they can address with their consuls. But today's information is with informational purposes only. Thank you. And I believe let's move on to VCU Health, because Evan, I believe you have also some great information about how you, what does your agency do when communicating with individuals with limited English proficiency and people with disabilities?
Yeah, so a big thing that we promote in our trainings, not just internally at Language Services at VCU Health, but also with clinical team members as well, is we promote the concept of language access, which is a bit different than Language Services. So Language Services is the office that holds all the resources from technology, services, and staffing model, whereas language access is the experience that a patient has when they, especially an LEP patient or hard of hearing or deaf, who prefers sign language for communication. How accessible is our patient experience to them given their language difference? And how can we ensure that their language difference doesn't equate to a communication barrier when they come onto, when they receive our services and attention here? And so that's kind of the concept that drives our office. And so it's not just about what do we do internally at our office, but also how do we train staff to almost think the way that we do in the lens of language transparency. So a big part of this is also training bilingual staff, the difference between them being bilingual and using their amazing talents to work and connect directly with LEP community members, but also where to draw the line as far as when an interpreter is needed to be a third-party facilitator so that they as bilingual team members can do their jobs, perform their jobs, and let us worry about the communication when it comes to their colleagues that are also involved in critical decisions and critical conversations. And so with that, we have an abundance of access to video and phone interpreters as we have to have language access operating 24/7 at all corners and all hours of the night and day. Currently with our demand, we have 25% of all of these encounters covered by on-site interpreters. And that's prioritized due to complexity, acuity, and high volume, places of high volume. For our deaf and hard of hearing, besides having on-site interpreters, which we do try to optimize as much as possible, we also ensure that our baseline access through VRI, video remote interpreting, is also substantial. And so we work very closely with our IT and our VRI vendor to ensure that we have optimal connection, as well as doing our best to provide training to staff on how to best work with community members who are deaf, as there's many elements, and as people have said here, many nuances that are really critical to making sure that that communication is adequate and it allows patients to make decisions based off informed consent. And as far as our high volume aspect, as Spanish is the vast majority of our language needs, we are continuously growing in our quality and our development for language access for Spanish-speaking patients. And we're really proud to say that our hospital is investing into 5 new full-time positions for Spanish interpreting. So we're really excited to expand our community here.
Excellent. Great. Thank you for sharing your thoughts and information. We have also Susan Davis with the Department for the Blind and Visually Impaired. So I was just curious, Susan, if you want to explain a little bit more, what type of technology do you use to communicate with those that are blind or visually impaired? If you can elaborate a little bit more how your agency handles that.
Sure. Thank you. So, you know, that a couple of principles that have already been mentioned are important to us and to the people that we serve, and that's what is the device, or what is the communication preference of their choice, their informed choice. We often, and by the time we see someone, they've been to a doctor and they've realized that they're not seeing. We actually serve more people that are visually impaired than are totally blind. So we're not just communicating with people that already know how to use technology. We're communicating with people that are learning about technology. So we use JAWS. You may have heard of before, that translates on computer text to speech. One of the benefits is that it is in multiple language, and if a document is coded properly, we'll switch voices depending on the different language you might be using. If you're also using the audio settings, changing your settings. It's harder to find, you know, German, French, Spanish, some of more common languages are pretty easy. It's a lot harder if someone speaks Farsi and you're trying to communicate with them through a screen reader. JAWS is not free. There is another product that is used that is a non-visual desktop access free product, and it uses also the Windows operating system. I can get you some more information after our meeting if anyone's interested. We use a lot of Zoom text, text magnification. We use Adobe Platform that has a read aloud option. It's very helpful. A lot of people think, and this is one of the things I like so much about what Eric was saying, is that, you know, an example is you might meet a person that's blind, and the folklore is that all people that are blind use Braille, and that's just not true. Some people do. In that case, we'll use a Braille embosser and the I hate that word retrieval thing that happens. The program Duxbury that's needed to create the Braille, and we use a lot of translators and sign language interpreters because we serve people that are deaf-blind. So that could be that we're using tactile communication where someone is interpreting and the person who is deaf-blind has their hands over the hands of the interpreter. and that's how they're getting their information. And then for people that have more vision, then we'll use regular sign language.
Excellent. This is such good information to have because again, each agency encounters different type of individuals, different type of disabilities. So learning from each other what is being offered, it's very helpful. We have also Lydia with the Disability Law Center, and she was telling me that they have a lot of, or they hire a lot of bilingual staff. Lydia, can you tell us a little bit more about that, how your agency offers services to limited English proficiency through your bilingual staff?
Yes, the first thing is the services are needed because basically language access is a fundamental right. And one of our that identify our services is that we advocate for the rights of people with disabilities. So the main thing is to have communications in between us, the other organizations that could offer services, and the clients. So that will ensure that understanding the programs, as a result, everybody will provide and have high quality of services. So we do have people, bilingual people over here, but mainly we use interpreters that are trained, they are qualified, and only the in-house is when a person comes and we can assist them. But we have also posters around, we have our information that is distributed to the population in 6 different languages, as you mentioned at the beginning, because Virginia is so diverse now that we have Chinese, Arabic, Vietnamese, Spanish, English, Korean, and other languages are catching by. So, excuse me, in having that access plan, the purpose is that the service to the individuals are satisfactory, that everybody receives the same quality of services. And that is why we make the effort to have trained and qualified individuals. For translated material, we also do the same. We use professionals to translate the materials because many of our information is very legal. And now, when you wonder what do we use, we have different, someone calls, we immediately can identify or ask them to identify the language. If they need assistance with a special phone because they cannot hear very well, we have the services here in the office. We have also sign interpreters. And so when we are inside of our offices and assisting directly the client, we have many tools to provide them that efficiency in the services that they need to receive in why they come to us. But we make sure, excuse me, that assistance, because it's very interpersonal, we can understand the cultural differences that are in the population, because it's not only to have interpreters or translators, it's to try and understand what really are the needs of the individual and go and approach them in that area. Our information, again, is distributed in different languages, and we also even have Braille. And as Susan was saying, not everybody speaks, manage it. So through education and through trying to use the assistance and the aids that are there, we are really encouraging the other organizations that provides services for people with disability to consider the language access. And as Evan said, language access is really the access for a good communication. As a result, as our outcome, the services will have a high quality. So what we do through education, we train other organizations that assist people with disability here, like the Division of Blind and Vision Impaired, or the Division of Assistance Rehabilitative Services, to know about the multicultural differences, to know really if they need assistance, language access, because they have to realize what kind of population you are attending. Really, you need the service because the demand is high. How can you assist them? And internally, it is very important to train the staff in how to act or respond to that need. For example, we have in our phones the small ticket sticker, so everybody knows how to access the direct line to get different languages, because it's not to have just contact with the service. It's really that at any moment we are able to access it and we are able to use it for a good communication.
Great. Thank you, Lydia. Yeah, the aspect of training is so important. We can have all these policies and procedures in place, but if we don't train our staff about it, we might not necessarily be implementing or have everyone in the agency implementing those. I hear a lot of you that use bilingual staff. Some of you are saying that we have competent bilingual staff, right? So I'll be interested, I'm sure the audience will also be interested in learning those that have competent bilingual staff with their organizations. How do you assess them? Do you offer a competency level exam? I'm sure a lot of people in the audience would be interested in learning more. And let's start with Enroll Virginia, with Carla and Sylvia. How do you assess your bilingual staff?
Thank you, Montserrat. So when we hire, we have bilingual staff on the hiring committee, and then we test proficiency during the interview when there is a language requirement for the position that we're hiring by asking the questions in Spanish. And at that point, the interviewer decides whether she's competent or not. And if testing must be done outside source, then CBLAS has a policy to pay for the testing. I don't know if there is anything else to say to add, Sylvia.
Yeah, ironically, we have 2 interviews following this panel.
Yeah.
And I've actually, it's been a long time since I don't think actually I've ever participated, but we use a committee at CBLAS, and we, as Carla mentioned earlier, we have a DEIB committee, and we want to make sure that one person, actually Carla is on the committee, so she will be in that to look at it through a equity lens. And then we have the person who's hiring for the job, who is looking for outreach workers. She will conduct probably half of the interview in Spanish. Now, I won't be able to tell the proficiency, but that's the beauty of having a committee, is for us to be able to, for her to be able to talk to us about, how she felt about the proficiency, as well as just the qualifications of the candidate. So that's pretty much how we do it.
Excellent. Great. How about at VCU Health? Evan, I know that you mentioned you have some tailored bilingual staff assessment that you conduct. Tell us a little bit more about that.
Yeah, for our bilingual staff assessment, we worked with one of our language services provider vendors, Language Services Associates, LSA. And they have a pretty good reputation throughout the East Coast, especially for many of the health systems here. And they had a bilingual staff assessment that they had for healthcare providers. Upon testing it and trialing it out myself, I felt that it was a bit too generic. A lot of these bilingual tests that are done by many vendors typically will ask just very vague questions, you know, like, what do you feel about the current political climate, or what are your aspirations? And these are prompts that just invite an examinee to showcase their proficiency, especially for Spanish, which is great. But at the end of the day, you can be an amazing socializer in a foreign language, but that doesn't mean you're going to be able to have clear professional language with your specific role in healthcare, or vice versa. There are many people who are bilingual providers that are actually really proficient in using Spanish in their specific roles, but they actually don't know how to really use language that with a deep articulation or fluency in other areas. So we really wanted it to be targeted in a pragmatic sense for various health roles in the healthcare system. So we worked with LSA for maybe about 7 months, and we created an exam, and we vetted it, and we trialed it with many bilingual providers that we were familiar with many ranges in fluency, and we really felt we hit the spot. And so now we have a great automated system where people can sign up. It's accessible. It's friendly for people with busy schedules, and you know, they're running all over the floor, but it invites them to take the test, and we give a lot of incentives for the bilingual team members to also take it, right? Because as mentioned earlier, you can have a bunch of policies, but if it's not enforced with incentives and safety metrics, then if the execution isn't there, then it's really just a theory and not so much a practice or a culture. And we're really happy that over the past 2 years, we were able to develop a really fun culture. And now we're working on even like badge holders that will showcase that you're bilingual, and it indicates that you passed this test as well. And what's really great is that when people are taking the tests, and whether they are you know, fluent in the target language, specifically Spanish, which is tested the most, whether they learned it or whether they're heritage speakers of that language, even if they do not pass the test, they get really detailed feedback that guides them in the areas that they improve on. And a lot of the feedback that we get is, you know, I really wish I had passed, but the test gave me insight that there's a lot of things they really never have bothered to really fine tune and learn when it comes to medical terminology. And while we always encourage people to use plain language, plain and clear language to patients, we also do hold an expectation that while they know the colloquial way to refer to medical conditions and practices, that they also know how to represent it at least at a more standard level, so that they're able to be more articulate if the event were ever to ask for that. In the same way that we do hold ourselves to a standard in English, we try to strive to use as much layman terms as possible, but it's still a requirement in professionalism to know the formal terms in case it's more appropriate. And so when we look at bilingual staff language access, we don't look at it as a favor, we look at it as just one other aspect in professionalism. And so we really love having this great interaction with our bilingual team member community, as we are able to guide them through this process in a really accessible, pragmatic way. But it also allows us to collect data so that we can showcase this community by numbers to our HR department to see how we can embed bilingualism as a professional aspect in the set of skills and tools that many of our awesome, talented team members have.
Excellent. Yes, I always tell the story that I feel like translating or interpreting, you have to be very knowledgeable of both languages. If you're translating or interpreting English or Spanish, you have to be knowledgeable of both. I'm bilingual. I speak Spanish. I learned English at a very young age. But the fact that I'm bilingual, that I'm that I can speak in both languages doesn't put me as a competent interpreter unless I follow certain training, because I was asked a couple of times in my previous jobs to interpret, but just because I speak the language or just because I speak both languages doesn't mean that I can provide an accurate interpretation. And that is very important, that when someone interprets certain encounters, we have to make sure that it's accurate, but it also that that person has followed or is following some protocols that you learn at a later time, which I learned too at a later time, and made me feel more prepared and equipped to interpret, and feel like I was more competent to interpret just because I took training. I learned about how to stand in a room when you're interpreting for someone. I learned how to just translate what or interpret what it's being said and not adding anything additional that that doctor is trying to tell their patient, right? So all that is very important when assessing bilingual staff and providing them with those tools to accurately interpret. Thank you. Thank you, Evan, and thank you.
Do you mind if I say something in response?
Yeah.
I really appreciate that answer, because it takes a journey to understand the differences between that. Language communication, or multilingual communication, is a very vulnerable process. And these conversations are, these policies are pretty concise, pretty well written, but the execution and the conversations around those policies are very much more intimate, very much more vulnerable, because language really represents our ability to reflect our intelligence, our competency, and even our identity. And so many bilingual team members have just the deepest and sincerest intentions when they intend to use their language skills with community team members. And so when I'm, walking around the campus and I'm meeting everyone and I'm, noticing these observations, I might step in to a bilingual team member or a team member who is bilingual. They haven't really taken the assessment, and I'll offer my presence to be present for a conversation that's being conducted in Spanish. Maybe I'll say, well, your colleagues here speak English. Why don't I keep them up to date with the conversation? And those interactions can be a bit uncomfortable for some people because they feel like they're put on the spot, or they feel like their intentions are being questioned. And it takes experience. It takes, really organic interactions to show this isn't about taking over your intentions. This isn't about replacing your identity or downplaying the reasons why you're at a Trauma One center like VCU Health. But it's really to showcase that communication is so much more multifaceted, and that at the end of the day, the patient cares more about quality and clarity than they do about identity association. And when we work with bilingual team members to say, in many areas you are bilingual, but when it comes to your role, you spent years in nursing or medical school learning these terminologies, it's natural that you're not always going to be as proficient when it comes to your role. So it does take really intentional conversations, and it takes relationship building and trust. So I really do appreciate your understanding and recognition that there's many layers to it.
Yes.
But on the outside, it just looks like we're paid to talk, which we are. But what goes on the inside is a whole other process.
Yes, excellent. I heard a lot of you also talking about signs and notices, and this comes to our next question, and is that how does your agency let others know that language services and auxiliary aids are available? I'll just be curious to go around the table to see which ways do you use, and let's start with the Disability Law Center with Lydia. I think you mentioned a few signs that you have around your office or entry. Tell us a little bit more.
Yes, first let me say that we really, the Disability Law Center of Virginia, do not relay on the staff to provide the services or volunteers of interpretation. We really make sure that when we contract with other agencies, they are qualified. And when we give the services face-to-face because the individual is here, or cases we have, we try to tailor it to the individual, because every situation is different. And as Evan and the lady before were saying, it is important to wear the exact hat at the moment that you are interpreting. If you work in a place and you have knowledge about the situation, but when you are interpreting, you are passing the information that the client is providing to you, not adding, not explaining, because you know the subject. But here in the LCB, we have signs at the reception, so we can show the individual their language in writing, and they can identify it. Because we need to understand that the level of need for interpretations are different. Sometimes you don't know how to speak the language, but you can understand some written materials. So we need to make sure that we know what is needed and how we can provide the services. We have the cards, all the cards where we provide information about our services and such are also distributed in the 6 languages I mentioned at the beginning. The same our brochures, and we try to make sure that the information is clear, so there will be a meaningful provision of the services to the client. And again, I am a trained interpreter. And that doesn't mean that I am not qualified because I am not certified. So that is a difference that we need to have when we try to evaluate the qualifications of the interpreter. But because it's important that they really know all these rules and steps that the interpreter needs to follow when they are providing services. We also, when distribute information, again, posters, our website is very, for me, it's excellent because it has a button that says languages. And it's fascinating because hundreds of languages can be utilized through that system. That doesn't mean that it's perfect. That doesn't mean that everything is well done. But in general, the individual could have access, basic access to the information and build up from there. So we really are trying to support the services we provide with an efficient language access plan and program.
Great. Thank you, Lydia.
How
about Enroll Virginia? We have I was gonna say, like, they mentioned the signs a couple times. What ways, how do you let people know that they have language access services for free available to them?
So in Enroll Virginia, we have our website in both languages, and also we translate all the materials in all the language needed when it is requested. Like we just have an event with the Tyson's Roots closure with a rapid response, and for 700 workers that they were laid off, and they spoke all different languages, and we had that translated right away so we could provide the materials in their target language. And as far as in legal aid, we have signs in reception, and one of the signs is translated in 24 languages, stating that the program is willing to provide interpreters at no cost for them. And also we have all the legal information in reception translated to, especially in Spanish, because it's the major language requested. But the most effective way we think that is to assess the applicant's need when they contact us, so we can tailor the language in accordance to their needs.
And I just also wanted to add to that, the majority of our clients come in through our phone lines. And so we do have a dedicated line for Spanish speaking, and that goes to someone who speaks Spanish and can do the intake and at least make the initial contact to see what needs to be done. And then if it's transferred to an attorney who doesn't speak the language, then we can use the language line to make sure we're getting the best translation.
Excellent. And again, the importance of the signs. Oh, yeah, sorry, Lydia.
Sorry, Monserrat, let me add something I think is very important. We can have, based on our experience, any kind of material, media, posters, and everything. But because language access is a service that is provided and determined by law, we have the obligation to tell the client that they have access to interpreters. Because people sometimes don't come to you because they don't know if they can have someone that speaks their language. So it is very important to let them know immediately that we have access to different languages and they have the right to ask for an interpreter.
Exactly. Yeah. So how about with VCU? I heard too about the signs, but also about notices. Do you provide also any type of written notices, or tell us a little bit more how VCU informs members?
So depending on how someone comes into our health system, it can either be by phone, emergency department, scheduling, or it could be a referral, or maybe it's a walk-in, for example, especially for urgent care. All in all, we do have as many bilingual forms, or as many forms, especially for registration and authorization for receiving services to be bilingual. In our registration process, we also do ask, what is your preferred language for healthcare communication? If it is a non-English language, we can provide interpreters at no cost to the patient. And we also, besides that, in providing translations on our signs, our marketing team works very close with us to make sure that as much marketing can include Spanish-speaking material as well as other languages. But we also purposely do have our VRI, our video remote interpreting devices, which we use the vendor Marty, which has very bright orange screens. And we like that they are quite ubiquitous throughout the campuses so that people can identify, I see that, therefore I know it's available. So we like to use that visual as kind of a reinforcer, not just in the paperwork and in the signs, but also in the patient experience as well as having bilingual team members and interpreters throughout the health facilities and campuses that also help reinforce the rights and accessibilities and options for patients when it comes to language access.
Excellent. So it looks like we have been hearing a lot of tips and good information about how implementing services, but I'm sure that we all have run into some challenges, and I think this information is going to be very helpful for our audience. If Susan, if you want to start sharing with us, what type of challenges have you run into when implementing language services, and what lessons did you learn? Susan, I think like you are in mute. Yeah.
Sorry about that. This is Susan. I didn't mean to cut myself off. I think we've probably had experiences that other folks have had experienced in that we may have an individual walk into one of our 6 offices or our headquarters or our library and resource center, and they need a translator or they need an interpreter, and we don't know that before people walk in. So one of the things we've learned is that we need to make sure that the individuals that are on the front desk know how to access, on-demand mobile apps that can help with remote interpreting, or we can access a language line on request. One of the things that I think that happened, kind of anecdotally, is that I was working this past summer with some of our transition age students, and I was helping to do an intake for kids coming in for summer sessions. And so the child, she was 16, she would have just really been upset with me for calling her a child, but the child was there, and there was another woman there, a young woman there, and there was another woman with them. It's multiple members of the family. And one of the women sat down at the table, and there was another helper. But nobody said anything to me about language. No one. So I started talking, and the younger woman, not the student, responded, and we're having this great intake. And then I needed to get some information, and she said, well, let me ask my mother. And her mother had been standing behind me the whole time, and she didn't speak any English at all. And the person that was serving as the translator was not a qualified translator, so had not informed me that the person, nobody said that the parent, the one with the legal authority over the daughter, didn't speak English. Well, we had a good laugh. Fortunately, we all had the good grace to laugh. And then I insisted that we start from the very beginning, so that this child's mother wasn't the one that was actually getting the information. And I think that's one of those lessons that we learned the hard way. We were able to, I was graceful, they were graceful. We laughed at how ridiculous it was, but it taught us a lot about needing to be prepared in the moment when somebody walks in and they need to have a conversation with you, and you don't have someone who is a translator on site. The older sister that was responding wasn't a qualified translator, right? So she's saying whatever she's saying to her mom. It's a big lesson and a valuable one for us, and probably one that other organizations have experienced as well, whether we'll admit it or not. So I think now we're not hearing you.
Yes, you're right. What I was saying, that it's true, and that's why it's so necessary to have interpretation and translation services already in place. So when you run into a situation like this, when you have that immediate need, that you already have those contracts, that you already have the procedures in place, so that we can serve the population better, and we're ready. So that's a very great challenge you explain, and a great solution just to be prepared next time. So how about Carla and Sylvia? Did you run into any particular challenges that you would like to highlight, and what lessons you learned?
Yes, thank you, Monse. I'm gonna tell you a little bit in Enroll Virginia, one challenge that we have encountered over the years, and what a creative way or a solution we found. And this is an initiative that we have going on right now that is a a scholarship actually to fund some interpreters. And this came on place because during the years we start going to the community in about 2013, right after the marketplace was put on place. And then we realized that a lot of people, they're not accessing healthcare, not only because of lack of information or knowledge, but also because of lack of interpreters, sadly. And what happens is like members of the immigrant communities, sometimes they don't fully trust the language line, or if they see that there's nobody speaking Spanish, or that the doctor doesn't only speaks English, so they'd rather self-medicate versus going, to the doctor and not understanding what's happening. And this is having really, of course, bad consequences. One, they end up in emergency room, cost for the health system, and especially, they're prone to be to having more issues like health-wise. And what happens is that we also see this is happening a lot in rural areas, and we see that the community clinics and the free clinics, they have the funds, but they don't find a good pool of qualified applicants or interpreters. So this initiative actually came with a great idea with one of our amazing navigators, Amber Peron, that she decided, well, we might be able to cross this bridge and try to find funds for interpreters. And we partner, we have a collaboration with the Liberty Language in Arlington. And right now we have funds. We have this scholarship for 10 positions. And we know some community centers that they're going to need interpreters. So we're going to fund interpreters who need money to get certified, and we're going to place them in these community centers that we know that they need interpreters. By doing this, we feel that we're going to improve language access across Virginia. And this is just like a small step that Enroll Virginia is taking to make a difference. And also after that, we might be able to do this in other organizations that we know that they need support or help in this area. This is an initiative, the project is going on, the people interested, they should just get my email and I'll get you in touch with the person in charge. And if anyone is interested in collaborating or just helping funding this project, I think this might help actually the healthcare, at least in Virginia. This is as far as Enroll Virginia, and then I'm gonna let Sylvia talk briefly about some of the challenges that we had at Legal Aid.
Goodness, how much time do we have left?
Sorry.
Well, I think our biggest challenge is that the demand for our services is so great, and sometimes the turnaround that we need to be able to help the client is so quick, particularly in eviction cases when someone has received that notice from the sheriff and they're coming in a few days. And so a lot of times, folks come into our office and they'll bring family members, and we have a policy about the use of family members. We want to make sure that we have the client's consent to do it, but at the same time, we also want to make sure that there's no conflict of interest in using that family member. We do have a policy against using minors, but a lot of times clients do want that security of coming in with someone they know and trust. But we have to make sure that we are providing the best, the ethical, we're abiding by our ethical rules to make sure that there is true consent. One of the other challenges that we have is that while we do have, and I think Carla mentioned how many Spanish-speaking folks we have in our organization, they're not really there necessarily to translate for our clients. And sometimes it's kind of catch as catch can, because they might not be available to work with that. And so, because they have other things that they have to do for the particular job that they're doing. And so a lot of times they're very, very willing to interpret and do some interpreting for clients, but that's not their core role. And so, we need to incentivize that as part of their job, because they like I said, Carla, I can grab Carla, but she may have an appointment, and it's, so it becomes a little bit cumbersome. And then, and then just one last challenge of, several other small challenges is training. We have a lot of non-bilingual staff, and a lot of times it's a cultural thing. And we need to, we just last couple weeks ago, we did a Friday lunch and learn on how to do a language line call, because people, even though we give them the cards and with the very specific instructions on how to do it, they still are a little shy about using it. And because it's just, it's technology, and some folks in the organization are better at technology than others. So we did a mock actual call to language line, and Carla and I facilitated a conversation. And so, it's just, keep hammering, that we can do this. We can have fluid conversations with our clients and make them feel welcome in any language. And so that's the challenge. And I think with the use of our DEIB committee, I'm really looking forward to some good ideas on how to overcome some of these barriers.
Thank you, Sylvia. And I love that idea about the lunch and learning strategy, because I agree, like here at our agency too, we try to make our DMAS staff feel comfortable about using language line. What you're saying, it's an additional step that someone needs to take, but it's so important to use those resources that are available, and whatever it takes to make someone feel comfortable about using or adding that additional layer, it's very important. And providing that information in a lunch break or in a training session during lunch, I'm sure that made a big difference. Excellent. Thanks for sharing that. How about for VCU, Evan? Did you all run into any particular challenges you would like to highlight, and what solutions you found?
Oh, yes. I'm always abundant with challenges when it comes to language services. So I always have a job here, which is great. So I would say our biggest challenges was really accessibility for the users. So I think oftentimes when we think about language services, it's very patient centered in the dialogue, which is great as far as the intention, but as far as execution, I realized there wasn't enough dialogue on the clinical aspect. How do you embed language services and all the protocols and training around that in a clinical setting where there are a million things going on at the same time? And so we really spent years, and each year had a different focus. How do we make phones more accessible? How do we make video technology more accessible? How do we organize our limited resources of on-site interpretings better? How do we make sure that our office has a website that's accessible? How do we track data? How do we keep up with retention on the team? How do we keep our team engaged in a way that it's not about coming to a battle every day, but coming to a place where there's growth and development, sustainability, change, yet stability? How do we make sure that we have a competitive compensation? How do we work with marketing? So every year there's definitely themes, and how do we grow? How do we advance? Because it's one thing to recognize the problems, it's a whole other dialogue to talk about what does the solution actually look like. So I would definitely say it's just really year by year thinking about what is the most critical to address, and what are the low-hanging fruits that we don't want to, as far as solutions and implementations, that we want to make sure that we're not overlooking as well. Not to mention policy, regulatory audits, safety concerns, and the pandemic on top of that brought a whole new layer. It just really transformed so many aspects in healthcare and especially in language services in the industry at large.
Excellent. Thank you, Evan, for sharing your thoughts. And lastly, let's ask Lydia and her organization if they run into any particular challenges. I believe you mentioned in the past that sometimes you schedule appointments and then client doesn't show up. Tell us a little bit more about that experience.
It is very interesting how all of us have different challenges, and at the end, all of us have the same one. But one of the main challenges is time. We need to realize that giving services in different languages requires time, and our staff needs to be conscious and aware of that, because we have a whole day schedule, and then we have someone that is coming with another language, and we want to continue at the same speed because at 1 we have an appointment or a meeting or so. So we need to make the constant effort of scheduling extra time when we are assisting individuals with different language. And that is why when they cancel or reschedule meetings or call at this last minute, it takes a lot of coordination again to find that spot and continue providing those quality services. In the action plan, that is why they insist that we need to evaluate and update the services really in what language we have more need, how many clients we assist in the other languages, and where we need to put our efforts. But that is why we really have more barriers and difficulty in time to assist the client. We cannot hurry through the interpretation and just to finish an evaluation or two, because we scheduled half an hour.
Yeah. And thank you very much, Lydia. And talking about time, we are hitting the 2:45. So I know we had an additional question for the panelists, but I feel like this is something we have already discussed. Unless any of the panelists has any additional thoughts to share about how to make materials available in other languages, I think if we have someone maybe that can speak to that for a couple minutes. Otherwise, we will move on to our next section, which is the Q&A. But I wanted to ask, yeah.
This is Susan. I'd like to add one more thing, and that's that we have at VDHH, the Department of Deaf and Hard of Hearing, a wealth of knowledge about how to access interpreters and training for interpreters and that sort of thing. And I feel like that we would be remiss to not recognize that that resource can be so helpful. I've got resources that I can share, and I noticed that Eric and a couple of other people have been on the chat, but I think it's very important to keep them in mind.
Thank you, Susan. Yeah, I appreciate that. I've been working with Director Raff as well about their certified American Sign Language interpreters. In fact, we have the 2 American Sign Language interpreters today are from the Virginia Department for the Deaf and Hard of Hearing. So I appreciate all the knowledge Director Raff has shared with us and also the resources from their agency so that they can provide certified American Sign Language interpreters. Thank you, Susan, for reinforcing that. With that,
another thing very quick is with written materials. We need to really make a conscious effort to provide maybe braille, maybe large print, and not too bright colors, And when we have pictures in the material, describe that the picture is coming, because when people use the readers, they cannot see the pictures. So, and we have many clients that they are upset because they are requesting large prints to the insurance company, and they act like they don't know what is going on. And really, that information is like this. Sometimes your glasses are not enough. So
Yeah.
it is easier to get materials that are accessible.
Thank you, Lydia. Yes, it's funny enough to understand, or it's important to understand that everybody has different needs and different communication needs. Thank you for pointing that out. With that said, we are at the end of our panelist session. I really appreciate all the information all these panelists have shared with us today. I learned a lot. I am sure that our audience has learned a lot today. And that is the main purpose of our forum, is just to learn from each other. There's a lot of challenges. There's a lot of diverse communication needs from our members. We all have different programs and services that we want to make sure everyone is able to access. So by doing this type of, or having this type of conversations, we're hoping that we can help the community and make a big impact to the community. We wanted to move to the next Q&A session. We have a few more minutes left for the event, but we have received, when you register to the event, we asked you if you had any questions that you would like to have answered today. So we are gonna start our Q&A session just addressing some of the questions that we have received through the registration. And if we have additional time, we will look. I've taken a quick look through the chat, and I've seen a lot of positive comments and a lot of questions regarding language and disability access that we would also like to address, but we might need to do that at a later time, and that information will be uploaded. But let me start with some of the questions that were sent by you all to when you register. One of the questions was, let me pull that list. So we got a question from the audience saying, besides the language line and TTY, what other services are offered to the public to assist with those who have disabilities? Or are there other programs being discussed for the future? So at DMAS, we recognize that there is no a one-size-fits-all approach. All agencies have different needs, but with our approach with the Medicaid program is to provide information and services for individuals with disabilities. We have the DMAS website that includes information on how to obtain auxiliary aids or other accommodations. That's a standard notice that we have on our website. It's also a notice that we include in all of our eligibility notices. So we inform individuals how to obtain those services, and we are just committed to assisting everyone obtain the information in a way that they understand and it fits their needs. And more information about language and disability access services will be incorporated on disability access future forum events. Again, we have one more planned for 2023 in December, and more information will be shared with all the attendees. We had another question from people who register that said, what is DMAS doing towards adding more bilingual staff? Is DMAS aware that using an interpreter significantly contributes to errors that delays the process and causes incorrect denials? And yes, at DMAS, we are aware that there are some situations where communicating with through a bilingual person might be offering better customer experience. Currently at DMAS, we have 7 English, Spanish, bilingual staff that they use their language skills to communicate directly with the Spanish-speaking individuals. We acknowledge that direct conversations or direct interactions between someone that speaks the language, it provides better customer service. However, we understand that not all situations, in all situations, we can use that resource, and that is where we would resource or outsource interpretation services through our vendors, where they will be able to provide competent and qualified interpreters. So that is how we assess or how we address the language needs through or bilingual Spanish-English speaking individuals. All right, so we got another question that said, are providers reimbursed for interpreter services? Currently, Virginia Medicaid does not reimburse providers for language services rendered to members in our fee-for-service population. However, providers who treat patients that are enrolled in a Virginia Medicaid managed care organization, we call them MCOs, those are the overwhelming majority of our population. Those can request language services through the members' managed care organization. So all Virginia Medicaid managed care organizations, they have actually procedures in place to provide language services to Medicaid providers and members at no cost. That was in relation to the question about providers reimbursing for interpreter services. And then we had another question. The question says, has VDDHH been mentioned in language access plans as a resource for information on communication access for people with hearing loss? And as I mentioned before, we have been working with the VDDHH agency for contracting certified sign language interpreters. Those procedures, we have them in our internal documentation, and we are planning on including those procedures to obtain American Sign Language interpreters through the VDDHH organization. We're planning to have those procedures also included in our language and disability access plan. We review the plan on a yearly basis, and our next updated plan will come up in summer 2023. So we are planning on incorporating these procedures to obtain American Sign Language interpreters were implemented at DMAS starting September 2022. So our plan is to include that information in our most updated language and disability access plan. And those were all. We had an additional question about if we were familiar with the deaf culture digital library. This is something that came from the public, and we appreciate that referral. I like to mention that referral here. This is great information that we also will be considering, see how we can be implemented on our efforts to continuously improve language and disability access. Thank you, everybody, for those questions. As mentioned, we addressed some of the ones that we received through the registration. It looks like my partner Jesus mentioned that, did you say, Jesus, do we have any additional questions that we can address in the next 2 minutes from the audience, from the chat?
Yes, Montserrat. We have received a couple of questions. One is from Steve Gordon. He is asking, where will a link to the recording of this event be available?
Excellent. Yes, definitely. We have been recording this event. We will upload the recording along with all the other materials for this presentation. They will be uploaded on the DMAS website. I will be sharing the DMAS website link with all the people that have attended to today's meeting through the registration. I have access to all their emails, so that information will be shared. We're planning within the next 10 days to have that information uploaded to our website. Thank you, Jesus. And thank you, Steve. Any other quick questions, maybe, Jesus, that we could use the next minutes to address before we close this out?
Yes, we have one more question, but this question, I am not sure if it was directed to the VCU's representative, because it came in the chat when he was talking in one of his interventions. And the question is, when you are recruiting for staff, do you add bilingual staff preferred, or how do you encourage bilingual staff to apply?
For recruiting team members that are, to look for team members that are bilingual, because we do not have any compensation or a different pay scale for those who are bilingual in their job roles. Our job descriptions for clinical roles typically will say something to the effect of preferred, I think, is typically what we use, or maybe something like something to the effect of environment works with LEP community members with a high volume or concentration of Spanish speakers. So either we'll say preferred, or the job description will describe that Spanish is a big part of the environment in which they'll be involved. It's only for language services roles for Spanish interpreters where language is specific as far as required, because we are paid specifically for that skill.
Great. Thank you, Evan, for addressing that question from the public. And we have reached the end of our presentation, but I didn't want to close before giving you some resources that you can look at your own time. Again, this presentation will be shared with the links to these resources. And I wanted to just emphasize on the last resource that we have here about WebEx event that is being conducted by the U.S. Attorney's Office. The event is going to be happening on June the 6th, Tuesday, and it's about ADA's effective communication requirements in healthcare settings. I feel that this event is going to be very helpful to the attendees, and more information, you can access it. I will provide that link through the communication that I will be sharing with all attendees when we upload all these documents. And with that being said, we are close to the 3 p.m. And again, we can be happy enough with having you all here, having this interesting conversation, learning about what everybody's doing, learning about how, or seeing how many people were interested in registering to the event, in learning more about how to better provide services to the limited English proficient individuals and people with disabilities. I want to extend a big thank you to my team that has helped me coordinate these, and also to the leadership at the Department of Medical Assistance Services. They have been very supportive to implement this initiative, and I'm very happy that we have been able to provide you all with the first forum on language and disability access, and we will be having more in the future. So stay tuned for more information. Thank you very much. Thank you to all the panelists who were here today sharing great resources and great information. I appreciate everybody's time.
Our pleasure.
Thank you.
Thank you.